Good evening, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD. This is actually the last webinar we're going to have for a few weeks, and so I hope we can get through a lot of information here tonight. To that end, I just want to let you know I have scheduled the next set of webinars. They begin the second Thursday in September, and tomorrow when you get the email with the recording of information about the recording of tonight's webinar, there'll be a link that you can sign up for the September series of the webinars, all right? In terms of those of you that are new here, welcome. And I'm glad to see some new faces. I also see a lot of familiar names on my message board as well, too. For you new people, there's a couple ways you can participate. Number one, you can listen to the questions as I read them out loud. Also, if you're in the live version, you can read them on your screen. They don't show up in the recorded version, no. And then see what responses I give. There's a lot of good education that happens that way. The other thing you do is actually write a question to me. And the way you do that is on the bottom right-hand side of your screen's chat box. You can write your question to me there. Just be aware that every time you hit the enter key, it sends a question to me. So I work best if you can send me a complete question. That means you're going to need to write your question as a big, long run-on paragraph, and that's fine. I can decipher that. And but if you hit the enter key, it makes it very difficult for me to follow pieces of your question if you do it that way. As I said earlier, I am recreating a recording tonight. And usually what I do overnight, if things go as planned, I'll do a quick edit in terms of snipping out the long introduction part that sometimes shows up where we're not on the screen. And then I also create a summary of topics that we talk about. I don't timestamp it because I don't have the time to do that, but I do at least create a synopsis of the things we talked about so you can kind of figure out if this interests you to hear it again, basically. All right. And so we'll get that out to you in the morning then too. And I think that takes care of the business end of things here. So let's go ahead and get started. All right. First question is from Dominic. Hello, Dr. Ross. Is it best to take low-dose naltrexone at night or in the morning? What are the side effects of low-dose naltrexone? Can it increase your heart rate? Thank you. All right. So everyone, low-dose naltrexone is a compounded medication that we use to help with pain and to regulate the immune system. Also can have some benefits for POTS, and it can have some benefits for mast cell activation syndrome as well too. And basically, naltrexone is a narcotic blocker. We at high doses, we use it for people with drug overdoses to knock the drugs off of the receptors. We use it at a low dose, and when we do it that way, it wears off in about 4 to 6 hours. And so what we're doing with it is we have a natural narcotic system in our body called endorphins. And we make endorphins to regulate pain, but those endorphins also regulate our immune systems. And if you block an endorphin receptor in the body, the brain doesn't like it, starts sending a bunch of signals to the endorphin-producing cells to make more. So they make more. And then also those endorphin receptors become very sensitized to any endorphin swimming around out there. So it happens at about 4 to 6 hours when the low-dose naltrexone wears off. These receptors get flooded with all these extra endorphins, and they're super sensitive to them too. Okay. Now, what that can do from an immune system standpoint is it can change the balance of an immune system that's not working correctly. So specifically, one of the things that can sometimes happen in people with Lyme is that you get an imbalance between what is known as Th1 inflammation and something known as Th2 and Th17 inflammation. Think of these two parts of the immune system. One part is the actual germ fighters. It's the offensive team, okay? And think of the Th2 and Th17 as your defense and your autoimmune kind of reactivity over here, all right? So Th1 are the cells that attack germs. Th2 would be your beta cells that make antibodies. Your mast cells are over here. Your cells that line your skin membranes and your mucous membranes that meet a germ as the first line of defense, those are all part of Th17. And in these illnesses, sometimes you get too much Th2, Th17. They make a bunch of cytokines that keep you inflamed, but the cytokines they make can suppress Th1, making it hard for you to fight your infection. Okay, so one of the things that low-dose naltrexone can do is it rebalances this. And the way it rebalances, one of the big ways, is there's another cell called a T regulator cell or T regulatory cell. Kind of think of it as the parent in the room trying to keep the kids under control. Okay, so the parent, the T regs, are able to get this back in balance again. All right, so it can be useful if somebody is having a hard time recovering from Lyme. It can help balance the immune system. If you've got a lot of pain, sometimes it can help with that by getting the cytokine balance down. The other thing it's useful for is fibromyalgia. And the way we think it helps with fibromyalgia, all that myalgia pain, that pain is generated from some irritated immune cells in your brain called microglia. And there is a toll receptor on the microglia that gets blocked by the naltrexone, which can help decrease all that myalgia muscle pains that people have as well too. How it exactly works for mast cell activation probably has to do with how it stabilizes mast cells by down-regulating the Th2 that I just told you about. How it helps with POTS, I'm not quite clear, but I do see some benefits on the POTS side with that too. Okay, so that's what low-dose naltrexone does. I'll show you a link to an article I've written about that. In terms of the timing of the day, there are two schools of thoughts. So the Europeans tend to use it in the morning. The US docs tend to use it at night, except for when their patients run into trouble with insomnia, then they move it to the morning. All right. So one of the potential side effects of naltrexone is it can lead to problems sleeping, and that often can be reversed by just taking it in the morning. Now, the reason that the US docs tend to use it at nighttime is that your body has a natural rhythm to how it makes endorphins. And there is a natural high of endorphins that happens at nighttime. So they're trying to do the blockade of your endorphin receptors to catch the upswing of endorphins that occurs in the middle of the night and the early hours of the morning, basically. In the end, it doesn't matter. You're going to do, I have my patients taken in the morning so they can get sleep, okay? So one of the major side effects can be insomnia. Sometimes people get a little clouded in their head when they take it. There are some people that get upset stomach from taking it. I have not seen anyone develop a heart rate issue from it. Okay, all right. So there you go. Let me just show you a quick screen share on this. All right, so this is my Lyme disease information site, Treat Lyme by Marty Ross MD. I'm just going to go up here and type in LDN. Okay, this is my article on low-dose naltrexone. And in here, I talk about how it works. I talk about those toll receptors I was telling you about. If you are going to use it, you need to give it about 6 months to see if it is going to help. And let's see. And I talk down here about when you might take it as well, too. In terms of side effects, anxiety, I guess, is one. Drowsiness can be one. Headache, insomnia, muscle pain, vivid dreams, mood change, and trouble with concentration. All right. Nausea, about 12.5%. Abdominal pain, 11.6%. And yeah, take a look here. At the bottom of the article, you'll see where I outlined what the potential side effects are too. Okay? All right. All right. Good luck to you, Dominic. Thanks for the question. Hello, Tim. Let's see. Hi, Dr. Ross. How are you doing? I'm doing well, thank you. Let's see. I was wondering if you know of any good ways to test for mineral and vitamin deficiencies. Are regular lab tests good enough for this? So for your regular vitamins like vitamin D, your vitamin B levels, folate levels, a regular lab can do quite well. For your minerals like magnesium, a general lab can do well for that. Calcium, a general lab can do well for that too. But if you want to get a better snapshot of actually what's happening inside the cells, there are various labs that specialize in testing for intracellular mineral content. And geez, I'm blanking on the name of it. It'll come to me. Actually, let me just Google here. I will probably come up with the name of it together here. I'm going to do a screen share. All right, let's see here. Cell mineral. That's it. So the company that I have used before that I think gives some good results. I'm sorry, I just had a brain fart moment there. I wasn't remembering it, but SpectraCell is a lab that many of us in the integrative medicine community will use that give us more information about what's going on inside of your cells. And that may be a better way of going if you're having mineral problems and vitamin problems of trying to figure out what's in there so you can develop a better solution for your problem. Okay? All right. Thanks for that question, Tim. Good luck to you. Hello, Lynn. Let's see. Hi, Dr. Ross. I have a note from a previous webinar on March 17th, 2022, where you said that sometimes too much glutathione can paradoxically cause an increase in cytokines. I was doing well with pain and inflammation on glutathione curcumin for several months, but then my pain came back. I checked the questionnaire, and I don't have symptoms of yeast. I take 1 teaspoon of trifortified 2 times daily. Might that be too much? Might it work well for months and then shift to increasing cytokines? I know I can reduce it and see what happens, but if there's a way to check that besides trial and error, I'd love to know about it. All right, let me try to clarify what I meant by that before. So when you use, glutathione, many of you know I recommend because it helps with liver detox, but it also is a very strong antioxidant, blocks signals that go to your white blood cells telling them to make cytokines. And for those of you that don't know, cytokines are inflammation chemicals that are made by white blood cells when they see infection, when they see the spike protein of COVID, when they see mold toxins in you, when they see too many yeast in you. Your white blood cells manufacture these chemicals called cytokines. And if your white blood cells have a hard time dealing with those problems, they start to manufacture too many cytokines. The idea that more is better, right? But not always. So if you make too many cytokines, the symptoms of too many cytokines are brain fog, body pain, fatigue, poor sleep, sometimes mental health problems. Basically, your Lyme symptoms are excess cytokine symptoms, okay? Now, one of the things you can do as trying to combat those cytokines is you can use glutathione as a strong antioxidant and blocks signals telling white blood cells to make those cytokines. The other thing you can do to lower the cytokines I like is using curcumin. Curcumin is a component of turmeric. It gets inside the white blood cells and blocks the production line. Okay, so how is it that glutathione can flare your pain then? Well, usually it's when you first start using it, not if you've been on it for a while like you're describing. And specifically, when you start using glutathione, if you are a person that has had blocked detoxification pathways, and now you start using glutathione to help your cytokines, but it also helps your liver detox, you suddenly take away the roadblock that's been holding back all of these toxins that have built up back there, and they come moving through the liver, all right? And the act of all those toxins moving can trigger cytokines, all right? So that's usually at the beginning of when you start using glutathione, when you remove the roadblock, that the act of detoxing triggers more cytokines, okay? But usually that's only within the first week or two. That's not going to be something that's going to appear later, like you're describing here. So I don't have the benefit of being able to ask you a bunch of pains to try to understand your pain better, questions to understand your pain better. So it's hard for me to venture as to why you're getting more pain all of a sudden. You also did one other thing that I usually suggest, and I want to explain what Lynn did here, everyone. So in my experience, when somebody's been doing better with Lyme and suddenly the majority of their symptoms start doing worse, not just one thing like pain or insomnia, but overall they start doing worse, then I suggest looking to make sure you don't have too many yeast growing in your intestines. Because again, if you have yeast in your intestines, they also trigger cytokine excess. And it can make it look like your Lyme got worse or your mold toxicity got worse, when in fact it's another problem triggering cytokines, okay? And Lynn went through the steps that I usually suggest for that, and she doesn't appear to have too many yeast. So Lynn, that was a good move on that part. But I'm not clear why you're having more pain. Again, I don't have the ability to ask the questions I would need to help sort that out for you, okay? All right. Good luck to you, Lynn. Hello, Dominic again. Let's see. Hi, Dr. Marty. Thank you for these amazing webinars. You're welcome. My new Lyme doctor tested me for Lyme and co-infections using DNA Connexions. I came back positive for Borrelia burgdorferi, at the OSB, Babesia decani, indeterminate, Bartonella bacilliformis, indeterminate, Bartonella henselae, NPS, and Borrelia recurrentis, indeterminate. I was also tested for Lyme via Quest. It came back negative. How accurate are these tests? Okay, so the Quest test and the Labcorp and the Dynacare and the PAC labs, the commercial labs where most people go to get their blood drawn, they all use test kits that are approved by the Food and Drug Administration, and they're approved by the Food and Drug Administration to be sold to labs, okay? And they use a method to evaluate whether we have Lyme that's approved by the Centers for Disease Control. That method, which is known as a two-step test, involves doing step one, something called an ELISA, that looks to see, do you have antibodies in you that might be made against Lyme? And then step two is, if that comes back positive, then you're supposed to have a confirmation test using a technique called a Western blot that looks to see, do you have antibodies in your body that attach to very certain specific Lyme proteins, okay? That commercial kit that is used by Labcorp, Quest, all the major labs, that ELISA portion of it will only find Lyme if you have it 50% of the time. That's called a garbage test, okay? All right, and even if it's positive, then you go on to the Western blot. The Western blot technique that's used by Labcorp and Quest has been shown in experiments to only find Lyme if it's there about 60 to 65% of the time. All right, so no, the lab you had done through Quest is probably not good. Okay, in terms of DNA Connexions, I don't consider that a good lab either. So DNA Connexions is doing urine testing to see if you have the genetic material from the germs in you. The problem with DNA Connexions as an independent lab, it is supposed to have run what are known as validation studies to prove to doctors like me that what they're doing actually works. And when you do validation studies, you're supposed to take known samples that have a certain infection in them versus ones that don't. And you're supposed to see how accurate is your lab at determining who has it and who doesn't have it, okay? And they've never done those studies. So I don't know. I don't know if they're valid. I will tell you, the reason I started asking about that is I operate as a referral doctor. I have a lot of people that come to see me that are referred in by their Lyme specialists when they're just wanting other ideas, or people will self-refer themselves in. So DNA Connexions a number of years ago did a great job of marketing to all the naturopaths in the area. So all these people were coming in with their DNA Connexions test, and those Connexions tests were saying they had Bartonella or they had Babesia. And when I would sit and start talking with them about their symptoms, none of their symptoms matched what you would see with the Babesia or what you would see with the Bartonella. So I really started questioning the validity of the lab, and I called them up and I talked to somebody in the lab, one of their lab directors, I believe, said, show me your validation studies. And they didn't have them to share, okay? So I don't trust that one either. The truth is, I think these days your best bet for testing for Lyme and for co-infections, although it tends to be more expensive, is to do the IGeneX testing. And for the test for Lyme, I like to do what's called their immunoblot test. It literally looks to see if you're making antibodies against 8 different kinds of Lyme germs. And in addition, they use genetically modified proteins to remove the possibility that you get a false positive if you've ever had like an Epstein-Barr virus or other virus infections, okay? Their Bartonella immunoblot is able to detect up to 15 strains of Bartonella, or your immune reaction to 15 strains of Bartonella. And so that tends to be one of the better tests out there for that too. And then they recently have introduced a Babesia immunoblot as well too. Their previous ways of doing immunoblot, I think, are hit or miss, but I think any labs, Babesia testing is hit or miss. Their immunoblot for Babesia, again, it just got introduced. I can't speak about its accuracy, but I do know the lab director and I know the work they've been doing. I would anticipate this is going to be a very accurate test as well too, but I can't give a full review of that at this point. Okay. All right. So yeah, I would look over to IGeneX. I would consider your Quest lab to be just basically a non-test because it misses it too often. And then regarding your DNA Connexions, who knows? I don't even know if this is a valid lab. They haven't shown me the information they need to that proves that their technique is accurate through a validation testing method. Okay. All right. Good luck to you, Dominic. Hello, Gail. Let's say hi, Dr. Ross. I have a few unrelated questions. My BUN and creatinine are always normal on my comprehensive metabolic profile. That's a CMP, everyone. But my BUN to creatinine ratio is always high, 23. It's the upper range of normal. And my most recent result was 30. What does this mean and should I be concerned? All right, so I'm actually not going to read every one of them. I'm just going to go one at a time here in terms of our response. Okay, so number one, so BUN stands for blood urea nitrogen, and that's a protein that is cleaned out by the kidneys. Creatinine also is a protein that's cleaned out by the kidneys. And probably the more accurate determinant of how your kidney function is the creatinine, all right? If you have dehydration, for whatever reason, that will give you a ratio of BUN to creatinine of 20 or higher. The most common cause of an elevated BUN to creatinine ratio is dehydration, okay? There are some people, even though they drink tons of water, will still have mild elevations of that, but it doesn't have any relevance to kidney function, actually. The creatinine is your more accurate indicator of that, okay? All right. Number two, I am in late perimenopause at 55 years old. I have had my cortisol level checked the last 3 years. It keeps going up and now is at 20.7. Normal is below 19.2. Do you think that low estrogen, I have hot flashes, etc., can cause an increase in cortisol levels? I sleep okay, but have to use medications in order to sleep. Should I be concerned? I don't think I have any symptoms of low cortisol. I don't think you have anything to be concerned about with that. You're still very much near normal. That's not a significant change. The other thing that may have happened is as you've been treated over years, it may be that your adrenals are just gradually working better and you're able to make that much cortisol right now at this point too. Okay? All right. Number three, lastly, I cannot tolerate the alcohol in herbal tinctures due to my bladder, interstitial cystitis. Glycerin-based herbs do not help my symptoms at all. I was told by an herbalist it's a myth you can burn off the alcohol. What are your thoughts about this? If you think it can be burned off, how do you recommend I do it? So the idea with alcohol-based tinctures, glycerin and alcohol are two liquids we can use to extract chemicals in a tincture from the plant into the liquid, basically, okay? And the most common used is ethyl alcohols or alcohol. And it does a good job of pulling the active ingredients of a plant into the liquid, okay? It is one of the thoughts that you can do when people are alcohol sensitive is if you put your tincture right before you take the drops or your quarter teaspoon, whatever you're going to do, you basically put it in water that has just been boiled. And that steam that comes off can vaporize the alcohol. All right. now, I've looked at some studies on that. Does all the alcohol get burnt off or vaporize off? No, unfortunately. I used to think it did, but when I look at the studies, it actually, there still is some left in there. And I think your herbalist is correct. There's still some. You can reduce it though. I have had people be able to tolerate their alcohol-based tinctures by vaporizing, by putting it in hot water. And so you could give it a try and just see, is there enough of a reduction of the alcohol that it helps your interstitial cystitis? That might be a way to look at doing it. Okay. All right. Good luck to you, Gail. Hello, S. Let's see. Have you seen difficulty in swallowing as a COVID symptom? Is one immune for several months after getting a COVID infection? So I have not seen in my practice difficulty swallowing, but I could imagine it could happen. The reason I could imagine it could happen is one of the effects of COVID has been neuropathy. And so nerves make your swallowing mechanisms work. So there may be a relationship. But before saying it's due to neuropathy, that's something that needs to be investigated by either a gastroenterologist or by an ear, nose, and throat doctor, somebody that can validate whether this is neurologic at all or not, okay? Because other things that make things difficult to swallow, you can get yeast in your food pipe that can make it difficult to swallow. You can get bad heartburn. It gives wearing down of the skin, that mucous membranes that line your food pipe, that can give you difficulty swallowing. So you need to find out for sure what the cause is before necessarily saying it's COVID related, okay? All right. And then, is one immune for several months after getting a COVID infection? So, and I'm not sure what the latest is on the BA5 strains, but the answer is you have some increased immunity, I believe, for 1 to 2 months, and then it all goes away. So there is a period of time, I'd have to look it up and see for sure what that specific length of time is, but there is a period where you tend to be more defended from having had the infection. And I think it's about 2 months or so that pretty much has that benefit to your immune system of having gotten COVID, and defending you goes away. It does seem to fade. Okay. All right. Good luck to you. Hello, Jake. Let's see. Hi, Dr. Ross. I took a panel of tests through IGeneX and tested positive for Lyme, Bartonella, and Babesia. I also tested indeterminate on both tick-borne relapsing fever immunoblot and the tick-borne relapsing fever IgG immunoblot. So you tested indeterminate on the IgM and IgG. IgM and IgG are two families of antibodies, okay? IGeneX says that indeterminate means that they only detected one tick-borne relapsing fever Borrelia species specific antibody. Would you consider these results as being positive or negative for tick-borne relapsing fever, or are the results inconclusive? Also, are there any herbal products you typically recommend to treat tick-borne relapsing fever? I would also like to thank you for providing us with a great online supplement store with high quality products and fast shipping. Well, thank you for that. I'm blessed by about 3 years ago, I moved my shipping down to Austin, Texas, where I was living at the time, or 4 years ago now. I guess it's coming up on 4 years ago. I spent a year down in Austin, and I brought my store with me, and I left it at a fulfillment center down there, and I've been very pleased with them. They just do an excellent job of getting things out fast, better than I could do when I was doing it out of my office here. And even with good personnel, they have it down there. So that's good. So I put it in Austin so that things could get to anywhere in the country halfway fast instead of having it placed here in Seattle where I am. So generally they do well. And as you know, I try to do the best job I can picking products that I think are going to help. So thank you for sharing that with me. I appreciate that. In terms of the tick-borne relapsing fever, and in terms of testing, so I just want to talk about what a test means, okay? So a test is only as predictive of an illness as, or actually, the predictive value of a test at determining if you have an illness increases if you have symptoms of that illness, okay? because there always is the risk of what's known as a false positive test, okay? All right. So if you test positive for Lyme, but you have no symptoms, you're 100% healthy, there's a chance that's a false positive test. If you test positive for Lyme, solidly positive for Lyme, and you have lots of symptoms of Lyme, then there's a good chance that test is right, okay? So you can't diagnose an illness just based on a test, all right? So in terms of helping to understand what to do with your indeterminate for the tick-borne relapsing fever, I would need to know a lot of stuff about your symptoms, to be honest with you, okay? So a classic tick-borne relapsing fever would actually have cycles of increased temperature, like every week, maybe every month. Somebody gets this cycle, usually it's on a week to every 2 weeks, but high temperature that goes up on a cycle. That's why it's called relapsing fever, okay? But there are some people that have tick-borne relapsing fever that don't get the temperatures, and all they have is ongoing achiness, fatigue, symptoms that look just like Lyme, for instance, okay? All right. And so with the indeterminate, it's indeterminate. It's not positive or negative, all right? I will let you know, though, the things that you would do to treat regular Lyme, Borrelia burgdorferi Lyme, will work for tick-borne relapsing fever. It's the same treatment. And so in terms of, does it matter? No, it doesn't matter in your situation, because you already know you have Lyme, you're going to have to treat for it. And the things that you do to treat for Borrelia Lyme are going to take care of your tick-borne relapsing fever, okay? All right. So the one thing about tick-borne relapsing fever, I know IGeneX was one of the first labs to introduce testing for that on a regular basis, is basically we're seeing that it has a chronic look that looks a little bit different than the relapsing fevers. So if somebody came to see me and they said, I got bit by a tick and I have a temperature spike every week to 2 weeks, I would just say clinically, that's tick-borne relapsing fever, all right? But what IGeneX has been able to show us through some of their research is that these people that we get like a negative Lyme test on them, but they have all the symptoms of fatigue and muscle aches and bad thinking, and they come back positive with tick-borne relapsing fever, that maybe this is what chronic tick-borne relapsing fever looks like. It doesn't necessarily have all those temperature spikes with it, okay? Let's see. Also, are there any herbal products that typically recommended to treat? Yeah. So, in my my online guide to treat Lyme, as you know, I list out a number of herbs in my treatment protocol, but also in my online guide about herbs that you can use. So herbs that address Lyme Borrelia also will take care of tick-borne relapsing fever. So those herbs are cat's claw, otoba, liposomal cinnamon, clove, oregano oil, Japanese knotweed, cryptolepis, although I tend to reserve those more for treating the persister aspects. They probably treat the growing aspects of Lyme as well too. So if that's all a foreign language, let me just do something here real quick. So we now know that Lyme, about 90% of the germs are growing and about 10% go into hibernation. They stop growing and they usually ignore the standard antibiotics. We call those persisters. Experiments at Johns Hopkins tells us a number of herbs can go after those persisters, and they tend to be liposomal cinnamon, clove, oregano capsules. Excuse me. That's what I like to use. I build that pretty much into all my treatments. But if that doesn't work, based on the Johns Hopkins experiments, I will also consider using Japanese knotweed, or I will consider using cryptolepis, which, based on their experiments that got published last year, are useful at growing and persister forms of Lyme. Okay. Now, to make a distinction, some of you may have all heard about spirochete Lyme and microscopic cyst Lyme. All right. So there's the growth state of Lyme, and then there's what the germ looks like. Okay. So the germ can look like a corkscrew. We call that a spirochete. The germ can look like a microscopic cyst, and the germ can lose its covering and move inside of cells, and we call that intracellular Lyme. Okay. Now, the spirochete and the cyst can either be growing or they can be in a persister growth state. Intracellular Lyme, we don't know. No one's done research to tell me whether inside cells do we have growing and persister state. I don't know. I don't know about that. I assume we probably do, but there's no way to know from the science about whether we have persisters or growing forms of the intracellular. Okay. All right. So I hope that gives you some information there. I'm going to just only do a quick screen share. I'm going to show some resources for people to take a look at. All right. So in terms of how I treat Lyme, and again, the things I would do for Borrelia is what I would do for a tick-borne relapsing fever. Take a look. This is my treatment protocol, the Ross Lyme Support Protocol under the Lyme Protocol tab. If you click on this navigation menu on the right on the Lyme infection, that brings you down to my herbal option for treating Borrelia. And again, this is what you could use for treating tick-borne relapsing fever, okay? And then in terms of what do you do, other options that you could look at in terms of treating the persister side, I'll just do this. I'm going to write persisters up here. There's an article I have called How to Treat Persister Lyme and Bartonella. And in here is where I talk about various options, including the oregano, cinnamon, clove oils, cryptolepis, Japanese knotweed. Okay. All right. So one other thing, I need to update this article, but there's this drug called Azlocillin that caught everybody's attention probably a few years ago. It now appears that the drug manufacturers are not going to proceed with trying to turn this into a product for the market. Okay. So they decided for various reasons that that's not what they're going to do. But anyhow, so that is not a drug that's going to be coming to the market anytime soon. Okay. All right. All right. Thanks for that question, Jake. Good luck to you. Hello, Deborah. Let's see. Hi, Dr. Ross. I am taking the oral BPC 157 to heal nerves, peripheral neuropathy. I just started 2 weeks ago, starting with 500 milligram a day. It flares the foot pain. I've noticed my feet warm and hot at night. I apply cold cloths that help. I'm also starting to feel hunger for the first time in years, but it is really fatiguing me. And I wake up with a slight headache. Why? I stop for 2 weeks and the fatigue is lifting. What to do? How long does this typically last? How long do I need to take it to heal the nerves? Thanks. So, Deborah, clearly there's some kind of a dosing effect here with you. And in situations like this, what I do with my patients is I have them even start slower. I might consider, if I had a patient that had similar problems like you're having, I would probably suggest that they try one pill every other day and see if it would be more tolerable for them, okay? The one thing I would point out, BPC 157, in addition to having healing properties to heal damaged nerves, stomach lining, muscle tendons, and ligaments, may, I use the word may, have some weak, and weak is the right word, weak antibiotic abilities. So there is an occasional person, when I start them on BPC 157, that gets a little bit of a Herxheimer reaction, all right? So what I would do is probably slow down. You might, in a situation like this, I would suggest to my patient that they do one pill every other day. The other thing is you might also, if you've got a physician you're working with, you might want to talk with them. They would know you better than I do. And I don't have, obviously with what you're written here, I don't know your whole health history, okay? But you might want to talk with them to see if this is the appropriate thing for you to be doing too, okay? All right. Good luck to you, Deborah. Hello, Heidi. Let's see. Is taking steroids always contraindicated with Lyme disease? What about low-level ones for POTS? Florina. Okay. Let me have a drink of water here real quick. All right. So is taking steroids always contraindicated with Lyme disease? So some steroids are. So prednisone, IV steroids, those are things you would want to think twice about, because those either injectable butt muscle injections or oral steroids that are going to go throughout the whole body may suppress your immune system, allowing Lyme to get more active. Okay. Florinef is a different situation. So Florinef is a prescription medication that we use for people that have some degree of adrenal dysfunction, meaning their adrenals are not making enough cortisol and other hormones like mineral corticoids, which are chemicals they make, hormones they make that help the kidneys hold sodium and minerals in the body, which helps expand your blood volume. So Florinef has small amounts of steroid, more at physiologic doses, more at the amount we would expect your adrenals normally to make. Okay. And Florinef also, I believe, is a mineral corticoid. I'm double checking here. I haven't used Florinef in a while. Bear with me here. No, it's a corticosteroid. It's a cortisone. Yeah. So it's the dosing that's being used with it is more at physiologic doses in a range that we would expect your adrenals to make on their own. And at that level, it doesn't suppress the immune system. So that's okay to do. Okay. All right. Good luck to you, Heidi. Hello, Colleen. Let's see. Hi, Dr. Ross. I'm going to begin taking phytostan and probiotics for yeast overgrowth treatment. I'm already taking one pill of the shelf-stable HMF Forte per day, plus herbal antibiotics for Lyme, Babesia, Bartonella, and one pill Reg Active Essential for you're telling me what's in it. It says in addition to synthesizing glutathione, this bacteria can also extract it from the surrounding environment and recycle spent oxidized glutathione back to its active reduced form. Do I need to add a spore-forming probiotic, or is what I'm taking sufficient? And at what times of the day should I take the phytostan and probiotic if I'm taking the herbal antibiotics at noon and midnight? Thank you for all of your help. Okay, so phytostan, everyone, is an herbal antifungal medicine, anti-yeast, antifungal medicine. So it has in it some powder caprylic acid, undulacinic acid. It's got some thyme oil, I believe rosemary oil in it as well too. Okay, you can take the phytostan directly at the same time you take your herbal antibiotics. You can take those together. Okay. In terms of the probiotic, I would take it as far away as possible from your herbal antibiotics. And so you might look at doing that first thing in the morning, well before noon, at least 2 hours or so before you take any of your herbal antibiotics. That's usually what I recommend my patients do. Okay. In terms of, do you need to be on a spore forming? So the HMF Forte is a human strain. You're also on the Lactobacillus fermentum would probably be a human strain as well too. You know, the thing you could add, you don't have to be, but you might find more benefit by taking a spore forming too. So human strain of probiotics are the kind of bacteria that live in our intestines naturally. And when you take capsules of those, the idea is that they're going to try to repopulate and help that intestines work better. Okay. Spore-forming probiotics are ones that come from the soil. They literally have a hard shell on them, covering on spore on them, which makes it easier for them to get through the acid of the stomach. There's some question as to whether they actually repopulate your intestines, because again, they're not there naturally anyhow. But probably what the science says that they do is they play a supportive role to help the bacteria that are already living in your intestines to work better, and for the human strains that you're taking to actually have a better chance of gaining a foothold. So if you were to enhance your probiotic program that you're on, you might look at adding in a core biotic, spore-forming probiotic, for instance. Core biotic is the one that's made by research nutritionals, and you might look at doing 2 pills 1 time a day of that. Okay? All right. Good luck to you, Colleen. All right. Let's see here. Hello, S again. Let's see. The difficulty with swallowing I mentioned with my COVID question is more like severe throat pain when swallowing, like a sore throat on steroids. That's why I wonder if COVID does this. I'm not aware that COVID does that. And again, this is something I probably would want to have somebody take a look back in your throat to see what's going on there, because they might see that there's yeast there. They might see evidence that you're having acid reflux, acid coming all the way up, irritating the back there. You may not even be aware, but often if we do regurgitate acid, we'll taste it in our mouth, but not all the time. You can have people with silent regurgitation, which will just give a lot of pain in the back of the throat too. And so your doctors would be able to tell by looking back there, and your nose and throat doctor with their fiber optic scope or their mirrors can get a good look back there and figure out what's going on. Okay. All right. Good luck to you. Hello, Shanna. Let's see. Hi, Dr. Ross. I'm having a hard time peeing and pooping. Daily, I'm taking 1,600 milligrams magnesium citrate, 3 grams vitamin C plus Japanese knotweed. Should I just take more, or do you have any other ideas? I'm dealing with Bartonella, MS, Hashimoto's, MCAS, eczema, psoriasis, hives, Irritable syndrome at age 70. I look forward to your question and answers and appreciate your website. Thanks, Shana. Well, thank you for saying that. This is with the Lyme and Bartonella and the MS, you're going to have a degree of neurologic dysfunction, and probably I'm going to make a statement based on a brief description. Okay, so just be aware there's some limitations based on the information you provided me, but in all likelihood, what happens in situations like this is Lyme and Bartonella can injure the nerves that make your intestines work correctly. So the muscles, their intestines are lined underneath the skin of the intestines. There's muscles, and the muscles are supposed to contract and push things through the intestines, basically. In Bartonella and in Lyme, you can get injury to those nerves, and they just don't function well enough, and you get a dysfunctional intestines, and that can be part of all of this constipation. Okay. So it's a difficult situation to treat. Right now, your vitamin C, as well as your magnesium, the main thing they're doing is they're helping to hold more water in your intestines to help make everything mushier so it'll go through easier. The other things that sometimes can be helpful in situations like this is to take a fiber or fiber-like compounds to try to stimulate the muscles to contract. Okay, and so one of the things that can sometimes be useful with that is a synthetic fiber. It's called Miralax. You could find that at most pharmacies over the counter. You do a scoop once or twice a day, or you can start taking fiber supplements like a Citracel or there's some other ones too, but fiber supplements that you would wind up taking one or twice a day too. All right. Often, though, you're going to need to work with the physician directly who can kind of help steer you through what to do in a situation like this. Is complicated and more complicated than I could work out in a forum like this. This is something where you need a good one-on-one relationship with your physician. Okay. All right. Good luck to you, Shannon. Hello, Wendy. Let's see. Hi, Dr. Ross. July 2019, I was bitten by a tick. 10 days later, started feeling very tired and headachy. Doctor put me on doxycycline for 9 days. I was also tested for Lyme with DNA Connexions. The results say Bartonella henselae. meaning that NPS is commonly detected in individuals with long-term infections. I was not treated for Bartonella. I know now that you don't like this test. Do you think I should redo testing with IGeneX? It's been 2 years later. I feel better except for internal tremors. My TGF beta 1 is high. I'm on 3 milligrams of low-dose naltrexone and curcumin. Thanks. All right. So TGF beta 1, everyone, is a cytokine that is actually a good cytokine. It actually helps, is one that's made when you have a lot of inflammation to try to quiet it down. Okay. And it can be triggered by either having active Lyme, possibly co-infections. It can also be triggered by having too many mold toxins in you as well, too. Okay, those are the two things that I'm aware of that will trigger that. Okay. So just so you know, if with that acute bite you had in July, that doxycycline that you had would have been short. Most of us probably would have gone, based on your having symptoms, if I was treating you back then, I would have treated you for at least 6 to 8 weeks. 9 days is a little short, okay? Doxycycline by itself, though, has the ability to treat both acute Lyme and acute Bartonella. Now, when you start getting chronic infection, then I usually say you need at least 2 antibiotics to treat the Bartonella. But, in theory, doxy by itself might have been enough acutely. However, you were treated short term. All right, you weren't treated long enough as far as how I would treat. Okay, all right. Now, in terms of the best way to see if you have it, no, I don't trust DNA Connexions. I talked about that already tonight. Okay, but I do like the Bartonella test out of IGeneX. It has been validated. It's shown to pick up Bartonella if you have it about 90% of the time. And the other thing that makes it useful is that it is able to pick up the whole family that includes 15 of the strains that can cause Bartonella. All right, so in other words, it has a good chance of finding up to 15 strains, okay? Now, the way their test works is it looks to see if you have antibodies against 4 specific strains, like a Bartonella henselae, Bartonella cantana, Bartonella vinsoni, and I believe Bartonella elizabethii is what it looks for specifically. And in addition, it includes a test to see if you have antibodies against the whole family of Bartonella that includes 15 kinds. So if your 4 individual tests are negative, but the family test is positive, it means you got one of the other 11 strains, okay? And it tends to be our better test. It might be useful to look at that because that would give you some ammunition to keep treating with antibiotics in a sense. The internal tremors that you're having is something, internal tremors is something I associate more with Bartonella than I do with Lyme, okay? All right. Good luck to you, Wendy. Hello, Deborah. Let's see. What is your experience with NAD? And for a very sensitive fatigue person sick with Lyme and Bart, how and by what route would you start it? And dosage. Would love your opinion. So this is one thing I don't work with. I don't have any experience working with NAD. To be honest with you, it's something that can be useful in mitochondria function. I try to repair mitochondria in different ways than using it. So I just don't have any working experience with that. Okay. All right. Sorry about that, Deborah. Good luck to you. Hello, Joyce. Hold on here just a minute. Let's see. Hi, Dr. Ross. Having had Lyme and a number of co-infections plus EBV and Candida rearing their heads from time to time since 2001, I have been to hell and back. After 15 years of being told I was crazy, I found a Lyme literate medical doctor who started me on my road to recovery in 2016. I have been following your webinars and protocol for almost 4 years now since I moved from Connecticut to Arizona. If I go off track, I feel horrible. In my quest to fully recover, I experiment here and there, slowing increasing numbers of drops of the herbs you suggest. I am not feeling like I want to die like I did in 2016. The only visible sign is a blistering of my right foot, which is how the ball started rolling in 2016. If I stay status quo with the herbs, I feel good, but never eradicate these bugs. Can you explain why this happens? Am I unearthing persisters? Is this dangerous? It is so not like me to experiment, but I am sick of my life with Lyme. There has to be a better way. Thank you as always. All right. So Joyce, it's going to be hard for me to say. I appreciate you wrote a number of things here, but for people that have a hard time recovering, and the story is they can't quite get over it, I usually spend a lot of time talking with them, trying to figure out what it is that's holding them back. In other words, I do an 1.5 to 2 hour visit. All right. So it's hard for me to tell based on what you just wrote here. All right. Having said that, in my general experience, what I'm starting to see is when people have a hard time recovering, we need to think, and I'm getting good results by focusing more on treating the persister side of things. So you could build a Bartonella Lyme protocol, for instance, using Japanese knotweed and cryptolepis. And I mentioned those two tonight earlier in my persister article. You may want to take a look back at that. But if you are not doing anything aggressive for persisters in your regimen, that is something I usually consider adding in. So that could be a liposomal cinnamon clove oregano, that could be a cryptolepis, it could be a knotweed, or you could just build a whole treatment for Lyme and Bartonella that is just using cryptolepis and Japanese knotweed. And those pick up growing as well as persister states, okay? All right. But again, I don't have the benefit of getting to ask you a bunch of questions here, okay? All right. Good luck to you. Hello, Jim. Let's see how Dr. Ross. Thanks again for these great webinars. You're welcome. Do you find the GA map test to be highly accurate, moderately accurate, or not accurate? It tells me I have H. pylori and Giardia, but the results are considered normal because levels are in the reference range. H. pylori is 410 with the reference range less than 1,000, while Giardia is 3,200 with a reference range of less than 5,000. This is a new concept for me to be told I have serious pathogen, but that it's normal levels. What do you make of this? Should I treat these pathogens? So the answer is not a straightforward yes or no. So when I do consider the GI map to be moderately to above moderately reliable, okay? But it's just giving you a snapshot of certain germs. It doesn't measure every germ that's in your intestines. It only breaks down a certain parts of it, all right? But if I've got somebody that has a lot of symptoms and they're showing up levels of an H. pylori that I know is not supposed to be there, or a Giardia that I know is not supposed to be there, and depending on what their symptoms are, I might treat for them anyhow. So you have to interpret the test based on what your symptoms tell you as well, too, okay? All right. Good luck to you, Jim. Hello, Alex. What are your thoughts about the monkeypox vaccine and Lyme, Bartonella, babesia mold patients? Can getting the vaccine reactivate any of these bugs? And most importantly, will this vaccine create a cytokine storm similar to the COVID vaccine? So the answer is I don't know. I apologize. I haven't looked into it yet. I should, but I haven't looked into it. So I can't give you a good comment. I haven't seen the safety studies on it. I haven't seen anything on it, to be honest with you. So it's something I have to become more knowledgeable about. All right. Thanks, Alex. Good luck to you. Hello, Duke. Let's see. Hi, Dr. Ross. I have symptoms of Lyme and did both the IGeneX Immunoblot IgM and the Immunoblot IgG test. The IgG test was negative, but the IgM test was positive. IGeneX then listed the results for the different Lyme species. It was positive for Borrelia burgdorferi, negative. It was also positive for Burgdorferi european. I was also positive for Borrelia burgdorferi species. Would you be able to explain how to interpret which strains of Lyme I have tested positive for? IGeneX does not make it easy to understand their test results. Also, since I have tested positive for at least one European strain of Lyme, is there anything that I should do differently when treating this type of Lyme? Your webinars are definitely the best webinars on the internet. Thanks. Well, thank you. I appreciate that. So, so first of all, let me just say something about European Lyme. So generally, the bigger European strains are not the B. spilmani, but the big European strains are Borrelia guerini and Borrelia afzelii. Those are the two big ones. And we're starting to see that they have migrated across the Atlantic Ocean from Europe to the East Coast, and especially out in the Maritimes of Canada and down into the New England states. We're starting to see a lot of afzelii and guerini. It would not surprise me if we're starting to see more of the spilmani as well too. Okay, but I do know about the afzelii and the guerini. In terms of European versus U.S. strains, there are some nuances to what the clinical picture looks like. There are some different dermatitises, for instance, that you get with afzelii than you might get with Borrelia burgdorferi. However, the actual treatment approach is the same, and your ability of success is relatively the same. Okay, so it doesn't matter whether we call this European strain or we call it U.S. strain. In terms of how do you design a treatment, what do you focus on, and how do you get a person better? It's all the same. Okay, all right. And then I know you listed out everything here, but definitely you have Borrelia burgdorferi. You've got Borrelia spilmani, which is one of the European strains. All right, and then the species means that you're testing positive against Borrelia in general, which of course you would, because you have two specific strains in that species that you're testing positive for as well too. Okay, all right. Then let me make one other comment. So one of the things that confuses people, doctors and patients, is that when a person has been sick for a long time and they still keep making IgM antibodies. And let me talk about that real quick. So the way that this IGeneX Immunoblot is an antibody test is looking to see, has your immune system made antibodies that attach to very specific proteins found on the covering of 8 different strains of Lyme germs, okay? And we measure to see if you have antibodies from 2 separate families that are called IgM and IgG antibodies, all right? IgM antibodies are what you make in an acute infection, and you make IgM antibodies for other infections. So for instance, you get an acute monovirus, you're going to make IgM antibodies against that mono. If you get an acute cold virus that you haven't seen before, you're going to make IgM antibodies, all right? Now, eventually, in all infections, what's supposed to happen is the IgMs are supposed to go away, and they're supposed to get replaced by IgGs. And probably in most infections, that is what happens. But we know from data collected from the NIH during their about 15, 20 years ago when they did their antibiotic studies trying to figure out if longer-term antibiotics will help people that have failed regular treatment. To enroll in those 3 studies that they did, people had to repeat Lyme test. These are people with chronic Lyme. And what was interesting is in their enrollment studies, about 55% of people that had quote unquote chronic Lyme that had been ongoing for a long time had positive IgMs. Now, they didn't make much of it. They didn't know how to interpret it, but it is a phenomenon that we see. Now, there's many different theories to explain why that happens. The truth is we don't know, other than it is something that we see. So Having an IgM that's positive is not a false positive. It just is something we can't explain why it happens, but you clearly are having some type of an immune reaction and you haven't matured to a IgG reaction, basically. Why? I don't know. All right. There is some newer data we're seeing that can happen in Bartonella as well, too. All right. So these are germs that don't behave the standard way. So, of course, doctors, instead of saying, I don't understand, they want to say you don't have it. The test must be wrong. But no, it is what happens. Their own research from the NIH shows that this is what can happen. Okay. All right. Thanks for the question. Hello, Carter. Let's see. Do you know what specific infection or mechanism of action causes low testosterone level? What level do you typically choose to start treatment? And are there any prescriptions or alternative treatments to help with that process? Thanks. All right. So in terms of the mechanism, so what happens is there's an area of your brain called the hypothalamus, which connects to another part of your brain called the pituitary. The hypothalamus is supposed to interpret your blood in your environment and figure out how much testosterone do you have there. And if it doesn't think you have enough testosterone, then it's supposed to send signals to the pituitary gland to release two hormones, something called luteinizing hormone and something called follicle stimulating hormone, to get your testicles to start pumping out more testosterone. Okay. One of the things that happens with that hypothalamus pituitary axis is when you have chronic infection or mold toxicity that is triggering excessive cytokines, those cytokines can interfere with the correct functioning of the hypothalamus pituitary. And so you can get low testosterone levels from that. Okay. Now, low is, there's the labs all report, you can either get something called a free testosterone or a total testosterone, and labs have a range. The way to interpret them, though, is based on what your symptoms say. So there's not a set low level. So you asked me what the number is. It's not a matter of the number. It's whether you also have a number of symptoms of low testosterone as well, too. Okay. So I can't give you a specific number here, basically, unfortunately. Okay. All right. Good luck to you. Hello, Lynn. Let's see. Do any of these herbal supplements, Silicuta, Hutania, Japanese knotweed, curcumin, cat's claw, cinnamon, clove, and oregano, oil, green tea, Capri Plus, interfere with the effectiveness of hormonal birth control? That's a really good question. So we do know that prescription antibiotics can interfere with hormonal birth control. We do know that. I will be honest, I have never seen any warnings that I'm aware of that say that herbal antibiotics interfere with birth control. Now, I want to give you a caution here. I said I have never seen anything that says that. I haven't actually specifically studied it to see if that's the case. Have I had people birth control fail when they've been on the herbal antibiotics? No. Can I give you a 100% guarantee it won't happen? No, unfortunately. But I haven't seen any literature to say that birth control is interfered with by herbal antibiotics. Okay? All right. Good luck to you, Lynn. Let's see here. Oh. Colleen, it looks like I've got a second version of your question from earlier. I'm just going to get rid of that. Hello, Charlene. Let's see. Hi, Dr. Ross. Do you know of anything that can get into the bloodline and kill biofilm and a tube bigger than the bloodline? It slows the blood and causes high blood pressure. Thank you. Charlie, I'm confused by your question. I'm not sure how to answer this. By bloodline, do you mean blood vessels? So I'm not sure what you're referring to by bloodline, if you mean blood vessels, and I'm not sure why you're saying a tube bigger than the bloodline. What I will tell you is things that can break down biofilms can include enzymes, antibiotics can break down biofilm to a degree. The herbal antibiotics, Banderol, Cemento, can break down biofilm. So there's a variety of things you can do to break down biofilm. And they would break down biofilm in blood vessels. Okay. All right. If you're looking for ideas on what to do for biofilm, let me just do a quick screen share here for you. All right. So in my Lyme guide, I have a section called biofilms. All right, and you can take a look at this article called Biofilms, Lyme Disease Gated Communities. And I go through what are biofilms, how do they work. I review that there are some research-based ways of removing them, and there's non-research-based ways. And then I walk through a number of supplements and even prescriptions you can use to break them up down here. Okay. All right. Good luck to you, Charlene. Hello, Michelle. Let's see. I took atovaquone and clarithromycin for 6 months. I pulse dosed the first 2 months, 2 weeks on, 1 week off. The last 2 months, I felt it was coming back, so I started taking atovaquone and clarithromycin again. The herxing has been very bad. The LMD suggested I do 4 days on and 3 days off. The 4 days on are awful, and the 3 days off are exceptional. I feel cured on these days. Do you think I shouldn't pulse? Do you think I should use 10 milliliters of atovaquone instead of 5 milliliters for 6 months to finish it off? Please note, I feel Babesia has been the easiest of my Lyme associated to cure. On a side note, I need to thank you. I would have never known I had Babesia if I had not attended your Q&A. 4 years ago, when you reported that when you have a patient whose symptoms are fear and sputting, you know they have Babesia. This is exactly described my symptoms and is how I knew I had Babesia. FYI, it has been hard to convince the LMDs. I have seen that I have Babesia. That's why it has taken so long. All right. So let me just make some general comments. In general, I choose not to pulse my Babesia treatments. And the reason I choose not to do that is that Babesia replicates every 24 hours. And in those days that you are off of the antimicrobials, it can come back. There is one exception to that rule, and that is, actually there's two exceptions. One is artemisinin. The herb artemisinin, I do like to do a 3-day on, 11-day off. And the reason is on those days that you're on, I just clobber a person with it. And the reason I go off of it for 11 days is the liver develops an enzyme that deactivates it. So you have to let the liver reset so that the artemisinin can start working again. Also, there's a prescription drug called Coartem, and it's, even though you take it for 3 days, its effect is over about a 2-week period of time. That one I also will pulse. And then finally, there's another medication called tefenaquine that also has a very long life that it's in you. So when you take a pill, it's in you for a long time. That one you can pulse. I pulse it every 2 weeks. Some of my colleagues are pulsing it every week. But keep in mind that's because it's in you forever. And that pill you take leaves a drug deposit that stays in you for a long time. Okay. But in shorter acting medicines like the clarithromycin and the atovaquone, I tend not to pulse. Now, having said that, if I've got a person that is just terrible the days that they're on, I sometimes will have days that I'll give them off just to give it a break before I go back on. All right. So I can't say that it's necessarily wrong what your doctor is doing here. I would say if you're having a hard time, though, just being on it at 5 milliliters twice a day, I don't think that you'd be able to tolerate going up to 10 milliliters twice a day on that. Okay. All right. Now, if you do your atovaquone, clarithromycin, and you fail it, then it's time to start looking at other alternatives. All right. And so you might look at some of the drugs I'm having success with when things fail, especially on the East Coast. We're starting to see just a lot of resistance to standard treatments. One of the things I like using is a combination of something called Primaquine with Plaquenil, and sometimes we'll do that. There's a newer drug called tafenoquine. It's hard to get your hands on, but that could be a tafenoquine-based treatment could be a way of going as well too. Okay. So let me do a quick screen share here to give you some other ideas of what you could do, especially if you keep failing this treatment. Okay. All right. So in terms of how do you take care of babesia, take a look at my infection treatment plans tab here. And then take a look at this article called Kills Babesia, Brief Guide. And then I basically describe two type tier 1 treatments. So there's atovaquone-based treatments. And so, for instance, the Malarone is atovaquone, has atovaquone in it. Mepron that you're on has atovaquone in it, okay? And then there are what are known as quinoline-based treatments, and that would be Primaquine and tafenoquine. I would suggest, if you keep failing the kind of treatment you're on, to look at either a Primaquine or a tafenoquine-based treatment. I've been having good success with these, okay? The tafenoquine is getting to be very difficult to find, though, unfortunately. All right. All right. All right. Good luck to you, Michelle. Thanks for the question. Hello, Doug. Let's see, Dr. Ross. My doctor wants me to take Epsom salt baths or have a few sauna visits before taking the real-time labs test for mold. It sounds like she wants to turn the test into a provocation test. I don't think a provocation test measures body burden and is inappropriate. What do you think? And thank you for all you do for the Lyme community. So I know there's a number of my colleagues out there that are doing these provoked tests for mold toxicity. And I, to be honest with you, I don't know whether it's valid or not. I haven't seen anyone do head-to-head studies to say that you find it more easily provoking than not provoking. What I can share with you is that I tend not to do provoke tests. I want to know what the average day-to-day burden is, not something that I trick into happening, basically. So, and that's just my own philosophy. And again, if somebody could show me a study that showed that the provoke test gives you any more valid information than doing a non-provoke test and giving you something that's going to get somebody well, I might do it. But I haven't seen those studies at all, basically. Okay. All right. Good luck to you, Doug. Hello, James. Let's see. Hi, Dr. Ross. I've been taking the herbs for both Bartonella and Lyme for 2 years to keep the infection at bay, but I've been battling with candida overgrowth. I started to get back into exercising over the last year, but recently have started to get pain in the calf and back of ankles on both legs when I start running at the gym. If I stop running for a week, it starts to go away. I changed running shoes, but still persists. Could this be a Lyme-Barth issue affecting nerves or muscles? What are the key differences? You know, James, I wouldn't say this is definitely a Lyme or Barth issue in terms of what these symptoms are. I'm not sure why this is happening to you. And I think I would need to ask a lot more questions, honestly. But I wouldn't say that that specific symptom, the way it's happening, necessarily says Lyme or Bartonella. And to help get to the bottom of it, I would need to spend a visit with you, which obviously I don't have the option of doing here. Okay, all right. Good luck to you. Hello, Astrid. Hi, Dr. Ross. I have had terrible pain in my ribs along the edge of the rib cage. It is getting better day by day. Do you think this is being caused by inflammation? What can I do to help? Thanks for these wonderful webinars. So I can share with you that I've had a few of my patients with Bartonella that get a lot of rib pain. I think it can also occur in Lyme. And yes, it can be from inflammation. Getting your germ load down by killing your germs and also using anti-cytokine herbs like glutathione or the curcumin or both in combination can sometimes make a big difference for that. Okay? All right. Good luck to you, Esther. Hello, Beth. Let's see. What are the symptoms of Lyme carditis and what tests would you run to determine if it is present? We are using cat's claw and otoba bark for my son's Lyme, but progressing very slowly as he seems to have a strong response to new medications than others may have. Currently, he is on 16 drops each dose. When increasing his cat's claw and otoba dose, my son often has a die-off reaction for the first day or two and pretty much behaves like other cytokine reactions he has experienced. With the exception that recently during these, his heart rate has been elevated and shows as irregular on the home blood pressure monitor for a day or two. Then once the die-off reaction is over, the heart goes back down to normal and the irregularity goes away until he raises the dose again. Have you ever seen this during a HERX or cytokine response? The answer is no. I haven't seen that during a HERX or cytokine response. I'm wondering how old your son is as well, too. Let me look up something here real quick. I'll look it up with you, too. So carditis, basically carditis usually is going to give you some chest pain. And it would be something ongoing. It's not going to be triggered as part of a Herxheimer reaction. I haven't seen it ever occur as part of a Herxheimer reaction. If he is having heart symptoms, to get a diagnosis when it's happening, you probably want to see his doctor to see if they can get EKG to see if they can see any electrical changes we might see when somebody has some inflammation around the heart. They may choose to get, they would listen to his heart as well too. And they may choose to get some blood testing measuring some chemicals that can measure inflammation around the heart. And I'm going to look that up here real quick, just a minute here. I'm going to do a screen share with you here. All right, so I'm just going to type in carditis labs. Yeah, okay. Yeah, they're gonna wind up doing just regular blood tests. They're gonna get a blood count. They're gonna wind up getting, and they're gonna look at a CBC. They're gonna do a kidney liver testing, and then they might do something called a C-reactive protein and something called a SED rate. The C-reactive protein and SED rate indicate inflammation, and for this, those would probably be a pretty accurate indicator of it. Now, I don't think there's anything else they would do. Bear with me here just a minute here. Yeah, I guess Mayo is saying that they would wind up getting cardiac enzymes. This is a blood test to make sure he hasn't had a heart attack, basically. They would get an EKG, chest x-ray, possibly an echocardiogram. That could be a way of seeing what the function is. The big thing, though, that I would do is see your doctor when it's happening. And they can get testing at that time, both the blood testing and the EKG at a minimum, to start to assess as to whether this really is carditis or whether this is just Herxheimer reaction involving some of the structures in the chest, basically. Okay? All right. Good luck to you, Beth. All right. Listen, everyone, that's it for me for tonight. I've enjoyed being with you here. I'm going to be off the next 2 weeks, but we've got 3 webinars scheduled in the month of September. So the first one, I believe, is going to be September 8th, which is a Thursday. The one after that is going to be on a Wednesday, and the one after that will be on a Thursday again. I seem to keep having some scheduling conflicts with my Thursdays with you, so I'm flipping into Wednesdays every now and then, like tonight, basically. But I do look forward to seeing you then. And so everyone, keep your eyes out on your email tomorrow morning. When you get it, there will be a sign up for the September series of webinars. And in addition, I will have a synopsis of tonight's webinar discussion, as well as a link to that. When you get those, feel free to share them with other people. Keep in mind, if you're getting benefit, others with Lyme will get benefit from these as well, too. All right. I'm trying to reach as many people as I can because I like helping people, and I hope you'll help me with that as well, too. All right. Good night, everyone.